Welcome back to the Your Health television program hosted by the Monterey County Health Department. I'm Emily Sciolto, your host today, and just about every third Monday of each month. I'd like to continue our discussion on disaster preparedness by welcoming my next guest, Ms. Lisa Angell. Welcome, Lisa, and thank you for taking the time to join us today.
Thank you for having me today, Emily.
Wonderful. Lisa is the Bay Area Region Hospital Preparedness Coordinator for the California Hospital Association. She is also a registered nurse with many years of experience at the Watsonville Community Hospital. Unfortunately for Lisa, and fortunately for the community, Lisa was working at the hospital on October 17th, 1989 at 5:04 p.m. when the 7.0 Loma Prieta earthquake hit. Lisa, can you give us a bit of a rundown as to what was going on? And I say unfortunately for you, but fortunately for the community, because truly it was fortunate for everyone that you were there.
Well, thank you, Emily. Thanks for asking. Our previous speaker, Tammy, alluded to, picked up a little bit on the hazards and the natural versus the unnatural event. And having worked at the hospital and having a responsibility for preparing these types of things, I find it a lot easier and more fun, actually, to prepare for the natural events. Although, and I'm a California native, so I went through many, many earthquake drills as a school child through our public school systems. I have to say that when it happened on October 17th, back then in 1989, it was very surprising. It was very startling. It was a much larger earthquake event than I'd ever practiced for or we had ever had any experiential reference. So it touched from a moderate-sized event and just took a peek at what a major earthquake would be. Fortunately for us, we weren't overrun with casualties and fatalities, so we got a chance to take kind of like, not the big one, but the big enough one. That's really the way I like to talk about it. It was the perfect storm, a very excellent, outstanding dress rehearsal for how a hospital would survive during completely disrupted environmental operations, and yet with a great expectation and need with the community to be providing health care. So what was happening is I was at work on duty planning actually ironically a disaster drill for Thursday.
Wow.
We were going to have a mass casualty event. We were going to have 6 patients. I was there with the local fire department guy. We were planning how we would put the cars on the scene and how we would practice for that. And then this big giant earthquake happened. I can tell you that up until the moment that it happens, all of your preparedness activities and everything, that is what is kind of like would be in your savings account. But the moment that it happened, you go right to instinct and right to how you are ready to prepare and respond. For me, fortunately, because part of my job at the time was to help prepare for things, and that was part of my job, I had a mind frame for it, but I was also in the mode, actually physically, kind of ceremonially, preparing for a disaster event with the fire department. So I felt good, even though it was a huge, huge event, very unsettling, no point of reference for it in terms of how large it was or whether we were okay or what. I can tell you that when it happened, everybody in the building went immediately into response mode. So therein, from one of the nuggets for today, therein lies my first point. If you're ready and you're prepared, then you position yourself to start a little further ahead into what might be happening. If you're not prepared, if you're not ready, and you haven't even conceived of this mentally or done some physical things at home to help you prepare, I think you would be at a bigger disadvantage. Not to knock on anything, but we have mostly fight or flight as our basic human responses. Right. This size event put many of our people into the freeze mode. It added a different response for folks. They were not intelligent enough to think about it, but this was as scary an event as most of us had ever experienced, and you sort of don't know what to do. So when you're in a position where you don't know what to do, if you have some instinctive training or responses ready, then you're going to get started. Right or wrong, you'll get started. Right.
So things you're preparing for a disaster. And disaster happened. You're standing there with the fire marshal, firemen, and everything starts shaking. Once the shaking stopped, or it seemed to have stopped, what was the hospital like physically, and And what were the staff doing? What was the staff, and what were the patients doing? Was everyone like, running around?
Good question, Emily. We were at about 70% occupancy.
Okay.
So we had about 70 plus patients in the building taking care over a 4-story span. The entire operational environment was completely disrupted. But as we learned later, the hospital had sustained such severe damages that it had to be completely rebuilt.
Wow.
So it was a big one. Fortunately for us, the types of injuries, and you can predict this, everybody can know what's going to happen, were things like having been falling down, cuts and bruises and bumps and strains and broken bones. So you know that you're going to have those type of heart attacks. You're not going to get an attack of appendicitis necessarily. So you know that you're going to have those types of injuries. All of those things happened to us in the building as they were happening within the community. It's just that the hospital is a little bit extra prepared, and my mind may very well be the only place with the lights on. That's what we are obligated to prepare and double prepare in terms of power and water and important things that Tammy mentioned in the prior segment. Because the hospitals are practiced for this, we have a sense of redundancy and resiliency in this matter. However, as we learned recently from gigantic events like in Joplin, Missouri, and over in Japan, that for the giant catastrophic event, I'm not sure that anybody could be fully prepared. That being said, for the moderate event or the manageable community event, hospitals are probably more prepared. However, if we're prepared and the community is not prepared, then a greater proportion of the community is going to be expecting something from the hospital because we may very well be the only persons with the lights on.
Right, and what does that do to your level of preparedness then?
Puts an extra weight on the hospital or the healthcare clinic or the physician's office to meet the community's expectation for public health and for public health care. All the government structures, all the government systems, and all of the private organizations and public organizations where health care is generally sought out and sought for after will be under the same sorts of stress and pressures, uncertainty. In our case, our building was completely disrupted, but we were the hospital, so we just pushed things around. We set up our receiving areas in the parking lot, and we made ready to provide care where we could, even in the middle of not knowing anything about how badly damaged the parts of the hospital were. While we were setting up for receiving patients in the parking lot, we were also evacuating patients from the upper floors because this was all going on simultaneously. When we practice for things kind of like you take a test. You answer question number 1 first, then question number 2, then question number 3.
Evacuate, set up a triage site or an alternate.
And so you practice with this, except in this particular event, the earthquake, the large enough scale earthquake, everything kind of happens all at one time. So you have to revert to what you've practiced for, but then do it all at once. Well, obviously you're not going to have enough people or stuff or space to do that. So you have to have a plan for priorities. You have to manage your priorities ahead of time. It helped that for my colleagues, great uncertainty, teamwork. However, people remained calm. We remained calm. We didn't necessarily know what to do, but we remained calm. We worked with what we had practiced. We avoided wasting time. One thing that is certain, if you waste time, you're going to cost money or casualties, people that I can't help if I'm using up all of the Band-Aids on the first 5 people that come in because they're really messy, but what about the next 200 people that are coming in? So we have to be able to be careful with how we use our resources. We have to know ahead of time that in a big event, we're likely going to run out of resources before we get a chance to take care of everybody. So right at the beginning of it, even though it's very uncertain, we don't have a lot of experience in it, at least having happened right to you, we know that we already have to start responding as productively and as effectively as we can.
So it sounds like you said a lot there, and I think what I got most out of that, well, I got a lot out of that. I love hearing you kind of recount and talk about this. So you mentioned that what I got is if you're not individually prepared, it's easy for a community. It's easy to see how a community could overwhelm the little resources there are You know, maybe it is a big resource. The hospital is a big resource, but it's easy to see how if they're the only ones in town with the lights on, it could get overwhelmed quickly.
Yes.
You also mentioned about expectations and what people can expect and what you can expect as hospital staff, and that is you're going to run out of resources before you get to everybody. Things are spread thin. Everyone will get, you know, something eventually, but things are going to be in need. You're going to be short items, people. You're going to be short things. So it's not like you'll go there and be admitted and you'll go to a bed and everything will be okay. There may be some, there's going to be some waiting. There's going to be some, we'll get to you as soon as we can type.
Yeah, it will not be business as usual, Emily. That's a given, number one. We will try our best to restore it as quickly as possible to as best as possible, but we'll be working under a new normal.
Right.
It will not be business as usual, and who knows how long of a period of time it will be. Monterey County, Santa Cruz County, and San Benito are geographically connected to the Bay Area, but we are much lesser of a priority in terms of population and needs as compared to the very heavily populated Bay Area.
Right.
So we've been planning for a long time, fortunately, with our geographical partners on kind of being our first way of winning, you know, our best resource to each other, because we don't really know who's going to be impacted the greatest at some point. Even in Santa Cruz County, it was very interesting how many people were hit and how many people were not hit. So those are things that you won't know. But you can anticipate them ahead of time. You can have important relationships with your neighboring healthcare workers and community health organizations and public health agencies and emergency services to be on tap for when it happens, but nothing will let you know exactly where you're going to have to put people or how you're going to use things or when will the people stop coming expecting care and medical care. You won't be able to know those things. So our challenge is to do it as quickly and as thoughtfully and as productively right at the start. That's based on practice. We have guidance for that in the terms of incident command system, which our partners in hospital, or excuse me, our fire and police and law partners use. So we operate under the same system in terms of making a plan, assessing the damages, making a plan, setting priorities to meet the priority needs. Naturally, in an earthquake, the care and the health and the welfare of the community becomes kind of a shared community responsibility. And a shared community responsibility now in ways that we understand that we did not understand back in 1989. The government will not necessarily be there right away for us. We will be without communications in order to tell, hey, help, we need some help here. Everybody will know that there was an earthquake event, but they won't know specifically how bad it is, say in Monterey County or in our little Tri-County area here in the Central Coast, but they will know that we've had one. And it's fair to think that the government will be busy taking reports and trying to help the greater impacted areas, meaning worse damages or more population to have to take care of, which leads us automatically to what we've always known: self-reliance, self-preparedness. It's the ticket, it's the key to contributing to a community's ability to remain resilient for a certain period of time, unknown what your details or your variables are, but yet to help strengthen the community's resilience in this sort of an event.
Wonderful, and that is the goal. That is the ultimate goal, is to strengthen resilience, build resilience within the community, and kind of own that resilience and continue that resilience from the individual level. So, you know, you kind of answered, you know, most of these questions here. What types of lessons did you learn that may be valuable for our viewers? I heard a couple different things from the last few minutes. You know, if you have anything additional to tack on to what was already said, feel free to do that. If you have any other advice for our viewers.
Few things, yes, a few things, because it's unrealistic, certainly, of course, from the hospital side, it's unrealistic to think that the hospital is going to be able to meet everybody's expectation for care during the first few days, 72 or 96 hours of a big situation, because we're not able to get the help that we need to be able to provide you. So self-readiness and then family readiness, it's the ticket.
Okay.
Wherever we work, trucks helping to bring supplies to the hospital. It's not just the hospital as the high-ticket issue. There will be many people whose normal job is to help provide supplies to help shift and meet a community's needs. So everybody being ready for themselves, and then our families being ready, because what would take me out of my role is if I wasn't certain about my family at home.
Right.
I would have to leave what I was doing. I happen to work at the hospital in the emergency department. But for anybody that's involved in any aspect of the response, family readiness, knowing that your family knows what to do, that your family will take care of it until you get a chance to check in with them, is like, I don't know, a giant winning the lottery, frankly, in this area, because then you don't have to think about that. The next thing is to know my plan. Know the plan for me, know the plan for my loved ones, and make sure that my loved ones know that. And how would my family keep safe if I wasn't there? That's because even if I was at the hospital and I left immediately, it would take me a long time to get there. Mm-hmm. If there's immediate issues, I have to be sure that my family knows what to do. For example, if my family lives in a 2-story building, it's the middle of the night. How do people get out of the house from a 2nd-story window? Having that type of stuff ready so that they could get out of the house immediately. Specific to earthquakes is that our community is going to want to go outside. People don't feel comfortable shaking and standing inside of the building. We don't do that as well. So if I know where my family is, I know how my family would keep safe if I wasn't there. Keeping your gas tank in your car more than half. When you see it's halfway full, fill it up. Gas tanks won't be, gas stations will not be open. All of us live in our cars and work and live out of our cars. Having our gas tank full, keeping a redundant set of things that you really need with you, because if you're not at home and you're not at work, then you're usually in your car. Mm-hmm. So I know my needs best. I know what my pets need. I know my medication needs. I have to have that actually physically with me, depending on where I'm going to be. And then from there is having a go kit so my young kids could walk out of the house and have something to get started with, realizing that most of the town and most of the community is going to move to the streets. Getting involved in our immediate area, knowing what my biggest vulnerabilities are, my personal family and family vulnerabilities and weaknesses are, because that helps me get ready, and at least to stay away from the hospital and the healthcare clinics, at least until I absolutely have to. And if I need to, then I need to. But if everybody pours in one direction, you can see that those resources are going to get very small very quickly.
Right. So the takeaway today, individually, preparing for an individual, yourself, and preparing for your family is the ticket.
Absolutely. And what to expect when you are seeking medical care in terms of how you can help take care of yourself.
Wonderful. Thank you so much, Lisa. I so appreciate you taking the time to be here with us today, and I think you very effectively illustrated some of the benefits of being prepared, with our viewers. If you'd like more information from the California Hospital Association, visit them on the web at www.calhospital.org. Again, that's www.calhospital.org. Right now, we're going to take a short break, but don't go away. We'll be back in just a few with more of the Your Health television program.